You have the questions, we have the answers. St. Kaneh-Bosem Consulting, a trusted medical cannabis nurse educator serving New England. Independent third-party evaluation for medical cannabis, cannabis use disorder, and CBD pet care. Our motto, do no harm. Check us out at 420nurse.org. You have
The stereotypical concept of a marijuana user, including a medical cannabis patient, paints a picture of a paranoid and lazy, slothful, dirty individual who lays in bed, when they're not lying on the couch surrounded by snacks to quell the munchies, who continues to live rent-free in their parents' basement, but is the colorful portrait of the lazy stoner inaccurate? If it is true, then how do you explain some of the world's most successful cannabis users like Bill Gates, Jay-Z, Michael Phelps, Drake, the Beatles, Steve Jobs, and Ben and Jerry? If these old stoner stereotypes, that once ruled pop culture, are inaccurate, what is the truth? By exploring the research we can dispel the myths behind the medical cannabis user of today. According to an article published September 29, 2020 in the Journal of Cannabis Research, titled Medical Cannabis Use in the United States, a retrospective database study, by Vikesh N. Mahabir, Jamal J. Merchant, Christopher Smith, and Alicia Garibaldi, a study of 61,379 medical cannabis patients over the age of 18 was conducted. The average age of these patients was 45.5 years old. 54.8% were male and the majority were Caucasian, at 87.5%. Female patients were older than their male counterparts at 47 years of age. Most patients reported cannabis experience prior to seeking medical certification, 66.9% to be exact. The top three mutually exclusive primary medical conditions reported were unspecified chronic pain at 38.8%, anxiety at 13.5%, and post-traumatic stress disorder at 8.4%. The average number of comorbid conditions reported was 2.7, of which anxiety was the most common at 28.3%. Females reported significantly more comorbid conditions than males at 3.1 compared to 2.3. So then, how do we define medical cannabis? Let's begin by recalling that medical cannabis programs began in the United States in 1996, with California becoming the first state to legalize medical cannabis. Since then, other states have slowly began adopting medical cannabis programs, with these programs evolving over time. Qualifying conditions for medical cannabis vary significantly state by state. So, it is suggested that you look at your current state to see what the requirements for medical cannabis are. The allowable THC percentage component of state-run programs also varies, with certain states only allowing access to high CBD, low THC products for medical cannabis patients. Furthermore, patients seeking medical cannabis in the U.S., in most states, are required to obtain a state-specific medical cannabis identification card, allowing them to purchase cannabis products from dispensaries to treat certain medical conditions. This card often will have a required renewal date as well. So, when we speak of medical cannabis, we are defining it as cannabis and cannabinoids that are prescribed by a physician, nurse practitioner, and/or physician's assistant for their patients, according to each state's law. This does not include self-diagnosis and self-medicating. Nor does it include the recreational use of marijuana. Recreational marijuana use involves using cannabis for personal enjoyment rather than for health purposes. The recreational use of marijuana can be contrasted with medical marijuana use, which, again, involves the prescribed use of cannabis to manage the symptoms of some medical conditions. And since health insurance currently does not cover the expense of medical cannabis, it's worth pointing out that on average, a medical marijuana user spends $136 on one purchase of cannabis product, every 10 days. Another survey solicitation was conducted through Florida's state medical marijuana treatment centers, local Southwest Florida community events, and on the Florida Gulf Coast University campus collected from May 2019 to January 2020. It consisted of 157 participants, 64 male and 93 female, ranging in age from 21 to 76 years in age, who completed the survey and were used in analysis. For occupational status, 71 or 45.2% of patients indicated working full-time, 48 or 30.6% of patients indicated being disabled, 32 or 20.4% of patients indicated being retired, 15 or 9.6% of patients indicated working part-time, 14 or 8.9% of patients indicated being a student, and 7 or 4.5% of patients indicated being unemployed. Almost all the patients surveyed reported using medical cannabis every day. The vast majority of participants, 147 or 93.6%, did not feel they had a dependency or addiction to cannabis. 11 patients, 7%, reported that they needed much less or a little less cannabis than when they started. 41 or 26.1% of patients reported needing about the same currently as when they started, while 35 or 22.3% of surveyed patients reported needing a little more, or much more, than when they started. 68 patients or 43.3% reported that their use depended on the severity of their symptoms. Most participants, 75.2%, said that they had used marijuana before receiving their medical marijuana card. These patients were asked about the cannabinoid ratios in the strains they used most commonly. Patients could report more than one category. The majority of patients indicated that the strains that they most commonly used had high THC rather than high CBD. 64 or 40.8% of patients indicated that their strains had high THC levels only. 115 or 73.2% of patients said their strains had high THC and low CBD levels. 56 or 35.7% reported that their strains had low THC and high CBD levels, and 36 or 22.9% of participants said their strains were CBD only, while 4 or 2.5% reported not knowing what types of cannabinoids were in their medical cannabis strains. When these participants were asked which route of administration they currently used, participants reported using the following: vaporizer/oil, 128 or 81.5%, smoked flower, 109 or 69.4%, tincture drops, 89 or 56.7%, edibles, 74 or 47.1%, vaporizer of dry flower, 47 or 29.9%, lotion, 54 or 34.4%, capsule, 38 or 24.2%, patch, 31 or 19.7%, soft gel, 9 or 5.7%, tablet, 7 or 4.5%, and others roots, 9 or 5.7%. The scientific literature on cannabis use has grown substantially since the 1999 publication of Marijuana and Medicine, and it continues to grow. This is a pivotal time in the world of cannabis policy and research. Shifting public sentiment, conflicting and impeded scientific research, and legislative battles have fueled the debate about cannabis acceptance in America. The phrase scientia potentia state is a Latin aphorism meaning knowledge is power. But to be more precise, knowledge is power and power provides information, information in turn leads to education. Education then breeds wisdom, and wisdom is liberation and understanding. If the public is to see medical cannabis not as a comic strip, but more as a Rembrandt, then it's time to end the stigma and educate and understand how to liberate the truth. The consultation of a medical cannabis nurse educator, like Christopher Bashaw, RN, based out of Dover, New Hampshire, can help you understand the myths versus the science behind medical cannabis. To learn more, check us out at 420nurse.org. Again, that's 420nurse.org.